What are biomarkers for lung cancer recurrence monitoring? Imagine having a way to catch lung cancer coming back early, even before symptoms appear or tumors show up on scans. That's what biomarkers for lung cancer recurrence monitoring aim to do. These are measurable molecules found in blood or other body fluids that can tell us if cancer cells are still present or if the disease is returning after treatment. They help doctors keep a close eye on survivors and catch any signs of relapse early, which can be crucial for effective management. One of the most promising biomarkers is circulating tumor DNA, or ctDNA. These are tiny fragments of DNA shed by cancer cells into the bloodstream. After surgery or therapy, if ctDNA is still detected, it can suggest that some cancer cells might still be lurking in the body. Monitoring ctDNA levels over time can give clues about whether the disease is likely to come back, sometimes even before imaging tests can see anything. This makes ctDNA a powerful tool for early detection of recurrence and helps guide decisions about additional treatment. Another important biomarker is circulating tumor cells, or CTCs. These are actual cancer cells that have broken away from the primary tumor and entered the bloodstream. The presence and number of CTCs can indicate how aggressive the cancer might be or if it is spreading. Studies have shown that rising CTC counts after treatment can sometimes predict recurrence months before scans reveal new tumors. Tracking these cells can help doctors decide whether to adjust follow-up plans or consider further therapy. Tumor-derived exosomes and microRNAs are also being studied. Exosomes are tiny vesicles released by tumor cells that carry molecular information about the cancer. MicroRNAs are small RNA molecules involved in gene regulation. Both can reflect the tumor's status and may signal recurrence risk. Although research is ongoing, these biomarkers hold promise for future clinical use. Traditional protein markers like carcinoembryonic antigen, or CEA, have been used in some cancers, including lung cancer. However, they tend to have lower sensitivity and specificity compared to molecular markers like ctDNA and CTCs. That means they are less reliable for early detection of recurrence but can still be part of a broader monitoring approach. In clinical practice, liquid biopsy is a common method to detect these circulating biomarkers. It involves a simple blood draw, making it minimally invasive and suitable for repeated testing. This approach offers advantages like safety, convenience, and the ability to monitor disease status in real time. For example, detecting ctDNA after surgery in non-small cell lung cancer patients can indicate a higher risk of relapse, helping doctors decide whether to recommend additional therapy. Combining multiple biomarkers can improve the accuracy of detecting recurrence. Using both ctDNA and CTCs together may give a clearer picture of what's happening inside the body. However, many of these biomarkers are still under research and validation. They are meant to complement, not replace, standard imaging and clinical assessments. In summary, the most studied and clinically relevant biomarkers for lung cancer recurrence are ctDNA and CTCs. They offer a non-invasive way to detect early signs of relapse, which can lead to more timely and personalized care. Ongoing research aims to refine these tools, making them more sensitive and specific, so they can become routine parts of follow-up care for lung cancer survivors. Always remember, if you are in follow-up care, discuss these options with your healthcare team to understand what's best for your individual situation.